Tonight on Let's Talk About Health, we got tips on how to sit and sleep in order to not have severe back pain.
We talk about waking up with stiffness in the back, especially after Kumar has been sleeping like a corpse all night.
Also, the story about how debilitating pain from a spinal injury caused a woman's life to turn upside down.
I felt very depressed, and do I want to be dependent on my family members?
This week, it's all about spinal health on
Let's Talk About Health. Welcome back to Let's Talk About Health. Now, have you experienced back pain so bad it made getting out of bed absolutely impossible? Now, this is what happened to Margaret, and here's her story.
Hi, I'm Margaret, and I'm 52 this year, and a mother of two. 10 years ago, I actually fell down from a flight of stairs. The moment when I fell, it was very scary. It was so painful, I couldn't get up at all. I did an x-ray, tailbone was broken, but the doctor said that I couldn't do anything. I just need to let it heal naturally. If I walk too much, even like standing for a while, it actually hurts a lot. It gradually became worse. Like getting up from the bed is like I need to lock roll myself down because I can't even like get up naturally. If I have to plan my day, it's actually quite depressing because I have to plan like how far is the bus stop? Do I actually have a place to rest even before I reach the bus stop? I was very young back then, like I was only in my early 40s. I love running, exercising. To not be able to do so many things that I love to do, I felt very depressed. And do I want to be dependent on my family members? So after like a couple of months later, I decided that I should actually go and seek another consultation.
Well, Margaret's condition is called spondylolisthesis. This is her x-rays of the lumbar spine. You can see this is L4 and L5. And what's very obvious is that you can see L4 has shifted forward and L5 is still at the back. You can see usually they're in one line, nice line. And in addition, this space on top, that's the cushions. And you can see that this space is very tall, but this is very narrow. And that's what she has every time she slips forward. Okay, there's no cushion to help absorb up, to support herself, and that's why she's getting a lot of pain. I want to bring your attention to another crucial anatomical structure, and that's the white colored tube, and that's the nerve sac. And when the spine shifts forward and the disc protrudes out, you can see there's a narrowing of the disc space and also of the thecal sac, compression of the nerve sac, and patients may have severe leg pain in addition to the back pain. One option that we can do is to help these patients is surgery.
The thought of surgery actually worries me. Initially, my thought is going to be a big incision, like you're going to cut me open. What if after the surgery I can't even move and it becomes worse than what it was before? But if I don't get this fixed, I'm going to depend a lot on my family members to do simplest thing that you can ever think of. Hence, I told myself, I just have to get it fixed.
After surgery, we have shifted the bone nicely in place. You can see they are nicely aligned now. And this is actually the real-life model. You can see the screws are over here, and it's connected to a rod. So all these implants, okay, help to stabilize the whole spine such that whenever she stands and walks and put pressure on the spine, she doesn't feel that annoying pain anymore.
When the surgery was over, I was very surprised that it is so successful. Just a keyhole, a very small incision on my back. It's very simple. I could discharge from the hospital in 3 days' time and I could walk within a week. Within 3 months, I could travel, and within 6 months, I could actually do all the activities that I used to do. To be able to walk without pain and do the things that I love to do and used to do, it's like having a new lease of life.
Such a relief to hear that, to be honest. Like, I'm so happy for her that she solved it eventually.
What an incredible story that is, I'll tell you. So joining us now to talk more about spinal conditions and surgeries is Dr. Jacob O. Hi.
Hey.
Thanks, Sonia.
Thanks
Hi.
for joining us. We saw you like a superstar in the video earlier on. I mean, it seems so simple when you were explaining it. When the doctors explained it, we're like, wow, so simple, right? So can you take us through what's going on? Like, how did she experience that? Is it similar to slip disc or pinched nerve or any of the above?
The
presentation is similar. Most times patients will complain of pain in the back. Sometimes, especially when the nerve is affected, it shoots down the leg. The difference between the two, spondylolisthesis means a shifting of the bone. So it's very unstable. So patients come with a lot of back pain. But in a slip disc, this is a spine, and the green color portion is really the lumbar spine, what we call the lower back, okay? And you can see very clearly the bones are these structures over here, and in between the bones are these discs, the cushions. I'm going to show it right down here. And you can see the yellow structures, that's the nerve. So what happens is when you have a slip disc, you can see this red protrusion coming out, and that's pinching on the nerve. You know, crushing it, and that's why patients will complain of shooting pain, or normally called sciatica, numbness, tingling, or sometimes in severe cases, some weakness as well.
Why are the titles for all this so chim? Why can't you make it simpler? Spondylosis, so sounds like a cafe.
Call it spondy.
You know,
Yeah, just you have a
Spondy,
spondy.
yeah.
Because I had a problem.
It is a cafe.
I had a major spine problem because I couldn't even stand up. So I had to crawl to the hospital. So then I went to chiropractor for a long time. Didn't work. So I went to a TCM and magic. Papa.
So you took some herbs and it fixed your back?
Yeah, I just do acupuncture.
Oh, acupuncture, okay.
Yeah, acupuncture, sorry.
Yeah, what happened to you? What was the issue? Did they diagnose it, or you just
No,
got some
he just
needles?
told me that wearing high heels and dancing on it for a long time. He said, what you can do at 20, you can't do at 40. This happened to me.
So
when
you
I
don't
was-
know specifically
No,
slip discs?
he said
or-
just one step before slip disc.
Yeah, I mean, I think a lot of people get back pain and they don't always go straight to a doctor. So they will often go for various other treatments, maybe go physiotherapy, chiropractor, osteopaths, TCM. So as long as the pain improves and settles down and patients recover, then that's great. But obviously, if the issue persists, if the pain is getting worse, and despite these treatments, then you need to see a specialist and have a proper diagnosis. As spine surgeons, what we worry about is when there's nerve compression. So when people start to get shooting pain down the leg, or numbness in the leg, or weakness in the leg, or occasionally they get disturbance of their bladder and bowel function. So these are things that we worry about, that there might be compression of the nerves that we need to diagnose and treat. If it's just back pain and there's no serious cause of the back pain, it will often settle down with other treatments.
So Kumar, how's your back pain now?
Oh, my back pain is really good because I have been sleeping on the floor for years because of my 2 dogs. And I sleep better and I've really not much problem.
Right.
I have a question in regards to that. Sleeping on the floor versus sleeping on a proper mattress or a bed, like, is there a big difference, or to each his own?
You know, it really depends on each individual person. So Kumar slept on the floor and it helped. So that's fine, because sometimes something too soft, you know, doesn't give enough support. No, that's bad too. Firm, I normally tell my patients something firm. If it's comfortable for you, take it.
Yeah, I guess if you're getting a good night's sleep, what does it matter if the floor is hard?
Exactly.
That's all that matters.
So back to individual.
I guess
Yes,
so.
absolutely.
Speaking of individuals, there's one individual in my life which is really fat. Is my dog.
She's not fat, she's just growing up.
No, I mean, she's heavy. She's a heavy
Okay,
puppy.
okay.
So
She's
she's
a
like
heavy
more
puppy.
than 5 kilos and she's not even 4 months old. Now, one of the things I have to do sometimes, because she's like babyish, I have to carry her. And I don't know if that sometimes affects your back, if you're carrying something heavy.
Because I have a 2-year-old child, and the issue for me is prolonged holding, not so much the bending down to pick up, because I can bend down properly and pick the child up, but after a while, I'm just going to drop him. No, I'm just kidding. It can start to hurt your back after a while.
Okay, so on that note, Dr. O, could you maybe share with us some tips about like carrying heavy objects, babies, dogs, people,
Sure.
you know, whoever?
So for Rishi, it's your dog,
Yeah.
or Mike's your baby.
Yeah.
For-
So a lot of times, elderly patients, for example, grandmas, they want to carry their kids, right? But it's too heavy, I can't lean forward. So what I tell them is they sit down in a chair, their kids come, okay, and then, or babies, they put them on their lap first. And once they carry them, then they stand up. That will
Right.
help.
And it's
Rather
like-
than leaning forward to pick them up, that can cause a lot of back pain.
And while you're on the way, grab a beer.
Yes, if you can.
and your emotional baggage together. Party.
Don't show up empty-handed.
The other thing, right, that I was saying is that sometimes I sit for a very long time because I was in the army. I'm ex-military, is what I'm saying.
But you sat a lot.
Special forces.
But I was the leave clerk. And I used to sit on the chair for a very long time, you know, getting the leave form signed. And I think that's how I got my back pain. Because those days they didn't have these ergonomic chairs.
Oh, yeah.
So is that something that contributes to like positive experience?
Chair.
Yeah, I mean, I think for the chair, it's more important to have a chair that supports the lower back and also to be mindful of your own posture, so not to have the shoulders slouched.
Just don't sit too
And then don't sit for too long. Yeah, exactly.
Yeah, just don't sit for too long. Walk around.
Take some breaks, walk around for a few minutes, come back again.
The best exercise is walking.
Yes.
To wrap this up, what are we looking out for? How do we take care of our backs and our spines? Keep them in tip-top shape.
If you have a pain, go and see the doctor.
No, yeah, that's okay. We've got that.
Yeah.
Good. Thank you, Kumar.
Yeah.
And see if MediSave can cover.
Yes, and maybe a bit of CPF or
Top
whatever.
two question. Would you like to answer that question?
Yeah, I mean, it's very general advice in a sense because it's things like eating well, sleeping well, less stress in our life, and also, exercising frequently, and then stretching exercises, being careful of our posture, not doing activities that may exacerbate pain. So there's a combination of things, but they're all generally sort of general lifestyle advice. But it's definitely important to be conscious of these things to prevent sort of chronic back pain.
Great.
It's time for a break now, but we want to thank both doctors for joining us here today. We really learned so much during the show.
But guys, don't go anywhere because right after this break, we're going to show you some exercises that you can do right at home that'll help keep your backaches away.